Welcome to our 5 on 5. We're pleased to welcome today by Andy Davidson, the President and CEO of Oregon Association of Hospital and Health Systems, OAHHS. Andy, thanks for being here today.
Thanks for having me. Appreciate it.
My pleasure. So, OAHHS, what exactly do you guys do there?
So we are a trade association that represents all of Oregon's 62 acute care hospitals. And we develop policy positions by working with all of the hospitals, community members, and others across the state. And then we advocate for those either at the state level in the state legislative process or at the federal level through Congress.
Okay. What are Oregon hospitals doing perhaps than other hospitals in other states?
Well, very progressive set of voluntary measures that Oregon's hospitals have undertaken over the past couple of years, whether it's with regard to their maintenance of effort for community benefit activities, the things that they do to provide back to their community in exchange for their tax-exempt status, or transparency of prices, costs, et cetera. Very progressive in terms of some of the policies that we've undertaken. We're quite proud of them.
Mm-hmm. And how many people would you say in Oregon right now are uninsured?
Sure. So the Affordable Care Act, what some people call Obamacare, has really been very successful in terms of knocking down the number of uninsured. Estimates that I saw for the end of 2015 put the number of uninsured in Oregon right around 5%, which is pretty remarkable when you consider the pre-ACA numbers had us at about 15% uninsured.
Okay, and so how has that affected your hospitals?
Well, in a number of ways, most of which are positive, but there are some areas that we've got to watch carefully. So on the positive side, the hospitals in Oregon and our association have always had universal access to health care as our number one goal and mission. So by providing insurance, you're certainly covering a big piece of that in giving people insurance, giving people the comfort and the ability to go and seek care. But then the flip side of that is their capacity to see those patients. And one area that I think is a great area of focus, not just in Medford or in Oregon, but nationally, is the provision of primary care services. So the downside has been there's a limited number of providers that can take patients who are newly insured in, right? There's a sort of a funnel effect.
Sure.
And so where do they end up? They end up in our emergency departments.
They still do.
They do.
Which they were often going to before.
They were, that's right.
Interesting. Okay, well, very good. We're going to take a quick break. We'll have much more in a moment. Stay with us. Welcome back to our 5 on 5. Again, we're here with Andy Davidson from the Oregon Association of Hospital and Health Systems. So, Andy, we were talking before about the Affordable Care Act. What about coordinated care organizations in Oregon? How have they changed the system?
So, again, a very progressive and interesting evolution on the delivery side of care, really taking Governor Kitzhaber's original idea, along with Senator Alan Bates here from your area, and putting it on steroids. So coordinated care organizations' theory really is how do you bring the community together of stakeholders to provide care together for a set amount of money. Mm-hmm. I mean, pretty straightforward, very complex to execute on. They have really, I think, engendered a sense of change and transformation in the work that physicians, hospitals, other community service organizations, and the CCOs themselves are undertaking. And there's still work to be done, and I know that Senator Bates in particular has some ideas about how to continue to evolve that model. But I would say it's been an incredible shot in the arm in terms of how is it that we're transforming, and it's sort of sped that transformation up a bit. Okay,
and what about, obviously this dovetails in with that, financial assistance? What options do people have through Oregon hospitals to get that kind of aid? Sure.
So you still have people who are unfortunately uninsured. We talked about that 5% level. And you have people who are underinsured. And so every hospital in the state of Oregon has set a minimum threshold voluntarily that for any family or individual at 200% or less of the federal poverty level, they can get free care. And every hospital has their own financial assistance policy. But that has become the minimum threshold, and we're really proud of that commitment that they've made voluntarily.
Mm-hmm. And how would people find out where they stand with that and where their individual hospital maybe closest to them might fit in?
Probably the best way to do that is to come to our website. It's www.oahhs.org. They can find a link to every hospital in the state. When you go there, you can look for the financial assistance policy on that hospital's website. Interestingly, there is also price transparency information provided as a result of a new law that we helped to pass that went into effect in July. So they can also access some of that price transparency information as well through our website.
Very good. Great to meet you.
Thanks for
so
having
much
me.
being here.
Appreciate it. Thank you.
Stay with us. We'll be right back.